At some point, she couldn't stand up off the floor or walk up the stairs, and we still had no answers. I carried a binder of paper records to every doctor's appointment so that I could keep them aligned. And I truly believe that if one of those doctors had been able to see her whole history, they would have diagnosed her faster. And if we had just had today's AI, then they could have connected the dots that the humans missed. Today, Morgan takes 21 pills a day, gets 2 infusions a month, and has over 40 patient portals. Her disease is very rare, but her experience, it's very common. And that is what we're here to fix today. Too many patients are forced to remember all the doctors that they've been to and log into portal after portal, repeating their story at every visit, and they don't have the digital tools to help them stay well. Meanwhile, every other part of our life is digital. I can order groceries and have them delivered in minutes. I get personalized recommendations on my other apps. But in healthcare, we still see it on paper and manual situations. But today, thanks to President Trump, we're changing that. Over 15 years, we've tried to regulate our way to a better outcome. And we have gotten a path forward, but they have not delivered the modern healthcare experience that Americans expect and deserve. I'm so proud today that these 60 companies have voluntarily stepped forward to make a pledge, to take action, and to join us to say, we're ready, let's fix this, we're in. We're trying something different. It's not regulation or rulemaking. This is a voluntary alignment around a shared vision, a commitment to work across boundaries, across competitors, and across silos. We're bringing together data sharing networks, electronic medical records, doctors, health systems, payers, and app developers. And we're asking one simple question: what can we do right now to make this work for patients? The companies pledging today are agreeing to collaborate, even with their direct competitors, because they know we can't keep kicking the can down the road. We have to stop talking about data interoperability and make the data flow. Here's something important. Not all patients will want these tools. Some will rely on their caregivers, and others will rely on their doctors, so they don't have to carry it themselves. But no matter how people engage, we must make sure it works for everyone. CMS is doing its part. We're clearing the path for innovation by building the long overdue National Provider Directory, a kind of digital map for healthcare that connects systems in real time and helps patients get more coordinated care. We're also modernizing Medicare.gov to feel more seamless and smart like other apps we use. But the government can't do this and shouldn't do it alone. These tools we need to make daily decisions must come from the private sector, and that's why this is so important. So let me tell you what this might look like after our collaborative effort. So Morgan, in 6 months from now, might show up to her doctor's appointment, and instead of filling out a clipboard with her 21 medications, 12 doctors, and her entire medical history, she can just pull out her phone and tap or scan a QR code and seamlessly transfer her digital insurance card, her verified medical record, and a digital summary that could help her provider get up to speed faster. We call this kill the clipboard, as President Trump said. After the visit, Morgan opens her AI assistant, a tool that she has authorized to access her records, and asks, what did the doctor say today? What did these results mean? What should I watch for now? And the assistant responds using her actual health history, explains her care plan in plain language, helps her track her symptoms, and even schedules follow-up visits if she needs them. And lastly, she has a new favorite app that helps her manage her chronic conditions, because for years, Morgan has said what other patients say: I only see a doctor a few days a year, but I live with this disease every day. Today, we're starting with apps that can support patients 24 hours a day from anywhere in the world. They don't replace doctors, they just fill in the gap between visits so that care is continuous and not episodic. So what makes this effort different? Today, we have all these apps that want to provide these services, but they can't get the data because it is so hard for patients to access their records. But today, we have 18 network companies who are here pledging to fix the infrastructure that makes this possible. They're doing this through modern data sharing networks that removes the burden on patients and providers and makes it available in real time using modern identity, just like when you check in at the airport. These honor patient privacy and transparency, and most importantly, it's a movement to work together to remove the friction that's holding us back. Because access to information shouldn't be a luxury, it should be a standard. So for all the Morgans out there, come join this movement with us at cms.gov. Let's kill the clipboard and axe the facts. Let's help make health tech great again. Or in this case, maybe it's for the first time. Thank you, President Trump.